Thank you. Zoom Siri. Okay. Okay. Bailey, I'll let you kick it off.
Sure. Yeah. Welcome, everyone. We'll go around the room and do introductions in a minute, but we're all meeting here today for the infrastructure sector of the Kansas City Physical Activity Plan. There's a nice, lovely website of the plan that I posted in the chat. If you haven't been there before, go check it out. But the infrastructure committee in particular has some strategies and tactics assigned to it. And some of those are, identifying how community advocates or community members like yourselves can both collect and use data measuring the health equity impact of infrastructure. And so that's kind of what we're here to talk about today is what do we as a group need to be doing and what steps can we be taking to reach some of the goals in the plan. There's different things noted in there like integrating active design principles within our land use and economic development planning and other sorts of things, or how do agencies reward or encourage active transportation as a use. But yeah, those are just some of the high overview topics of what the infrastructure committee is. And I guess maybe, yeah, we'll do introductions. And so thanks for kicking us off, Teresa. I'm Bailey Waters. I work for the city of Kansas City, Missouri in our Public Works Department in our multimodal division. And I'm one of the co-leads with Teresa for this infrastructure group. So Teresa.
Yeah. Hey, everyone. My name's Teresa. I work for Bike Walk KC. I do all of their community planning work. And I'm helping alongside Bailey to co-lead this infrastructure committee. I'm going to call people's names out so we don't have constant awkward pauses. Robin, will you introduce yourself next, please?
Yeah, good morning, everybody. My name is Robin Shook. I'm an associate professor at Children's Mercy, and I'll tell you, I lead a group here called the Kansas City Healthy Lifestyles Collaborative. I'll explain how that fits in with all of this stuff in just a few minutes.
Garrett?
I'm Garrett Kaus. I'm a project manager here at Garver. I'm in the transportation field.
Awesome, thank you. Noelle?
Hi, Noelle Bunyan with the City of Riverside. I'm capital projects and parks manager, so I focus on trail and park improvements for the city.
Awesome. Christina?
Hi, my name is Christina Hoxie. I'm with Hoxie Collective. We're a community planning office in KCPA. And so I find myself having lots of conversations with community members about how to make sure they've got active land use and safe streets and sidewalks to get around their neighborhoods.
Thank you. Matt?
Good morning. My name is Matt Davis. I'm a senior planner and project manager with Jackson County Parks Plus Rec. Thanks for having me.
Yeah, thanks, Matt. Natalie?
Hi, my name is Natalie Updike. I work with Robin on the KCHLC team. I'm a research associate at Children's Mercy, and I'm going to be sector support for this sector. So you'll be seeing emails and newsletters and meeting invites coming from me in the future.
Yeah, thanks for mentioning that, Natalie. Natalie will be the one coordinating with the group moving forward, just doing like emails, follow-ups with notes and things like that. So we're very grateful for her support. She's also helping take notes during the meetings, which is super helpful. Nicole?
Hi, Nicole Brown, Johnson County Health and Environment. I maybe have the gist of the introductions. I work on safe routes to school, physical activity, nutrition, tobacco use prevention programming.
Awesome. Thank you. Sarah?
Sarah mentioned in the chat she's maybe stuck in another meeting, but she says Yeah, she wrote that she's representing Lincoln University, and staff from her Urban Impact Center would like to participate.
Wonderful. Okay, thank you, Sarah. Patrick?
Can you see me? Teresa, can you see me?
I can see you, and now we can hear you.
Okay, great, cool. Hi, I'm Patrick Truba. I'm at Mid-America Regional Council. I'm in their transportation department as the active transportation planner.
Awesome. Thanks for joining. Laura?
Hey, everybody. I'm Laura Fox. I'm Director of Education at Bike Walk KC. Worked on the beginning of the Kansas City Physical Activity Plan with the infrastructure sector. And so since Bailey and Teresa have taken it over, would love to just kind of see how it continues to evolve.
Awesome. Okay, last but not least, Katie?
Hi, everyone. My name is Katie Horner Gonzalez with Katie Gone Consult, and my background is that I've previously worked with a handful of agencies around the city, or around the Kansas City area, with a huge focus on these topics. So really happy to be here.
Awesome. Thank you so much. Thank you to all of you for being here and sharing a little bit about yourselves. Before Bailey keeps going, I just want to mention there's going to be a map in a couple of slides that's going to show you what areas and counties that this plan is meant to impact and work for. And if you see who's on the call today and can tell that there's certain demographics missing, certain geographies missing, please send a note in the chat, speak up, or you can send us an email afterwards. We want to make sure that, we're getting everybody here that we need to, because it's a 6-county region, so it's covering quite a big area. All right, Bailey, I'm going to move on to the next slide for you.
Yeah, just checking. Did we miss anyone? I don't know. Miss Takita Brown, I don't know if we called on you.
Oh, sorry. I don't.
Hi, can y'all hear me?
I'm so sorry. Yeah. Yes, thank you.
I'm Takita Brown, and I'm administrative assistant at Lincoln U in KC area, but I'm just sitting in for Miriam Helene.
Awesome, thanks.
You're welcome.
Did we miss anyone else? Just thinking. All right. Great. Well, yeah, again, back to the infrastructure sector and what brings us here today. In the actual Kansas City Physical Activity Plan, there's kind of a multitude of goals that we can be focusing on in this sector. And I think mainly our focus right now that Teresa and I have identified is how does active transportation infrastructure influence health outcomes? And so kind of trying to find or determine any links we can find between those two things, between health and active infrastructure, and focusing on what sort of information we need to identify an answer to that question. Yeah, you feel free to add anything, Teresa. And then this slide is in the plan as well, but it shows the rankings of what grade the Kansas City region has received. And in the active transportation, you can see we've received an F on our active transportation. So it's maybe a sector that Kansas City really needs to do a lot better in. And so hence why we're all here and why we all kind of work in this field anyway. But yeah.
Robin, do you want to jump in here and give an overview of the plan at large and maybe comment on how infrastructure fits into that?
Yeah, absolutely. Do you mind if I share my screen?
Not at all.
So my name is Robin Shook. I'm the director of the Kansas City HLC. So just a second. So I do this stuff a lot for all of our other sectors. So I'm just going to go through just kind of real quick a couple slides that I've shared with every other sector that we have. Hopefully this makes sense to everybody. So our group at Children's Mercy, that's myself and Natalie, and there's a couple other team members. We're called the Kansas City Healthy Lifestyles Collaborative. Our goal is to foster collaboration across community organizations within the KC region around healthy lifestyles. So we do, mostly our work is focused on physical activity and healthy eating. Obviously, what we're meeting about today falls under the physical activity category. Even though we work at Children's Mercy, we don't work directly with patients and families. Instead, we work directly with community organizations like all of you on this meeting today. So we started the one initiative of our group, the Kansas City Physical Activity Plan, about 4 years ago. There is a national physical activity plan that probably no one has ever heard of. It kind of works behind the scenes to support federal recommendations around physical activity. We all know that you can tell someone to be physically active, but unless they live in supportive environments, they're not going to actually have a positive behavior change. So the plan is designed to create a supportive environment for physical activity. And how we do that is through multi-sector collaboration. The goal is to create safe and equitable opportunities to live an active life in our region. So I kind of think of this work as an onion. On the outer layer of the onion is the Kansas City Physical Activity Plan. Then the next layer in is the 10 societal sectors where we're operating, and I'll show you those in just a second. Then within each sector, there are strategies which are kind of broad goals that, if implemented, would create safe and equitable opportunities to be active. And then within each strategy, there's a tactic, which is an actionable item. And you'll see all of those that we've created in just a second. And then, of course, one thing that we have heard over and over again by every single sector is this is not just a paper plan. This is a plan that we want to put into action. And so that's kind of why everyone's here today, is to kind of put the plan into action. You can go to our website. I put that link right there at the bottom, and Bailey shared it as well. So here are the 10 sectors where we're operating. The idea is that you probably touch on 1 or 2 sectors in a given day as you move throughout your life. Over the course of a week, you probably touch on somewhere between 5 and 10 of these sectors just as you move through your life. So the sectors are listed here, and under each sector is a name or names. That's the community organizations that are leading the work of that sector. And then in the numbers, those are specific implementation things that they're working on. So we'll just go kind of in order here. Schools, healthcare, parks and recreation, sport, mass media, marketing and communications, infrastructure, faith-based settings, public health, early childhood, and business. So again, as you think about your day and your week, you're probably touching on most of these throughout that period. And the idea is if all of those different sectors can be working in collaboration together to make changes, you are going to have a big systemic collective impact on public health. We do have my team at the HLC. We serve as the backbone organization for the Kansas City Physical Activity Plan. That means we provide like the funding. we provide the support within these meetings, setting up Zoom links, taking meeting notes. We will send out all those notes in the form of a newsletter within a week or so. Maybe Natalie, if you want to put the link to where we store all those so people can get a sense of where you can find them. In addition, they'll come in your inbox, but we also post them on our website. So that's what my team does. And we rely on Teresa and Bailey and all of you for content expertise, because that's what we don't know. I'm not going to go over all this, but here are the 40 strategies that currently make up the Kansas City Physical Activity Plan. And each of the different colors represents the sectors. You can find them all on our website. There's 40 strategies. Within each strategy, there's somewhere between 3 and 5 tactics. So we've got over 150 actionable tactics that people can implement to create safe and equitable opportunities for physical activity. And here are the 3 that compose the infrastructure sector. Again, you can find them on our website. And I think Teresa and Bailey might talk about them a little bit here. But I do just want to call out Laura from Bike Walk. She is like the godmother of the infrastructure sector of the Kansas City Physical Activity Plan. She led this work to develop these strategies and tactics. And so we would not be here today if it wasn't for Laura. So shout out to her.
Really quick while we're here, Robin, will you go back really quick? So Bailey and I, just since this is very broad and there are limitless directions we could take this work, we decided to focus our time, at least initially, on working most closely with this strategy 8, which is around data and using data to help make the connection between our physical health and, you know, the infrastructure and the interaction between those two things. We're certainly open to discussion around that, but that is what we've structured some of our prompts around today. We felt like that might be one of the more concrete ways that we could start getting into this work, just so the group is aware. Sorry, Robin.
Yeah, no, absolutely. Yeah. That's exactly right. There is so many opportunities that this is why we need everyone's content expertise to say, okay, of all these things, I mean, we want to do all these things, and maybe we will over a 5 or 10 year period. But right now, what should be the focus? And then I just also wanted to, just as a resource for everybody, either within this group or within the work that you're doing outside of this group. As I mentioned, there is a national physical activity plan, and we model ourselves after them. A lot of the strategies that I just showed on the previous slide align very well with what the national plan is working on. And I serve on the steering committee of the national plan, and their goal is to support efforts, local efforts like the group here. So I'll continue to share resources with this group about what the national plan is doing. But here's their 5 strategies. And if you click on this link here, and I'll throw it in the chat here in a second, they've got a whole bunch more information, and they talk about a lot of other things in more detail that may be of interest to people. So for example, I was reading this morning, one of their specific tactics was about clear recommendations for parking minimums for businesses and residential areas. And I know that I don't think we're going to be talking about parking minimums right now in this group, but I know that discussion is happening broadly within Kansas City. So I encourage you, if you're working in those areas, check out the national plan and see if that might be something that would be helpful for you. Okay, let me stop sharing my screen. Okay.
Awesome. Thank you, Robin. Yeah. That was super
helpful. Let me know
helpful.
if there's any questions. And of course, yeah.
So really, the only thing I'll add on to that is this map here that is on this PowerPoint. This is the regional area for the Kansas City Physical Activity Plan that we are focused on. So it's a 6-county area across state lines. And yeah, just keep this in mind while we talk today. Bailey and I are probably going to keep thinking KCMO very quickly. So it's going to be really helpful for us, especially to have people from other parts of the region sharing what your side of the story is, so to speak. So, okay, Bailey.
Yeah, thanks. So we wanted to talk a little bit first just about the expectations of the group and the structure we plan to have, just so you all are aware for how much or how little you're signing up for. And our goal for this is to keep these meetings virtual, because we feel that that's maybe a little bit more accessible right now, and so everyone is able to join. And we anticipate meeting quarterly. Teresa and I will put in a little bit more work behind the scenes between meetings to prepare things, but we really want to make these meetings more of like a work session or collaboration, so that the work you're doing as a part of this committee is done at the meetings themselves, if that makes sense. So that's how we intend to structure it right now. Things can always change, but just wanted to put that out there. And then just leading into that, our first item, like Teresa mentioned, is just identifying kind of what we should first tackle. Each sector has the opportunity to get $15,000 or up to $15,000 to help advance one of the tactics they're working on. And so we identified the tactic that seemed most tangible and most I guess easy to tackle first, being like the data gaps and or data analysis that might be needed to link active infrastructure to health outcomes. And so that's kind of what we are wanting to have discussion on today is how can we start tackling that task, and where do we think we should go for that? So this next slide kind of just has a bunch of notes that Teresa and I had put together beforehand for some discussion, but really wanting to open up the Zoom mute button and bring people off mute and have a discussion about what kind of data do we currently have that talks about health outcomes and their impact from active infrastructure. So what do we have that is existing? What do we think would be helpful for us? And maybe how can we get there? So that's kind of broad, but hopefully is a little bit honed into of a specific tactic that we're working on. Teresa, I don't know if you want to add any more on that thought.
No, I think that's great. I know it's a little awkward sometimes to just start talking when we've all been muted, and listening to people talk on Zoom feels like it's really hard to speak sometimes, but please feel free to take yourself off mute. I mean, we can all come off mute and just share a little bit and try to pretend like we're in a room together, or you could throw things in the chat. I think initially, I don't know if it could be helpful to say, like, what data do we know exists that could help us tell the story of active transportation's influence on health and equity, or if we want to talk about things that we know are missing through work that you've done where you've not been able to make a connection that you think exists, but there aren't numbers that can help, reinforce that. Yeah, Patrick, go ahead.
Yeah, if you were talking about data, I had sort of a big idea, and I'll try and explain this as coherently as possible. But for a long time, Mark has had a dream of a regional counting program. I mean, focused on bikes, but I mean, not necessarily excluding pedestrians. And back when we made our regional bikeway plan, the idea was to buy a bunch of counters, like, you know, eco counters or something similar, and spread them all over the region and start building data that way. And that never happened. We had a sort of a small counter fleet of our own that we loaned out to local governments. But those are all so old and either dead or not generating good data. And the landscape has just changed since then. Like automatic counters are still a potential part of a accounting program, but you also want to look at, you know, bigger data sources like Strava. We just got access to replica data. I think our Operation Greenlight program has Mio Vision, which is like it'll count bicycles and pedestrians at intersections. Um, and so there's a lot of potential pieces there. But I've also been wondering about how to actually contextualize any of this data. Like the best idea I had to do that is to work with our travel demand model people to like put it into the model, and maybe we could have a mix of like real and modeled counts to get a better picture of the region. They seem really interested in that. They really want to do that. But I'm not sure exactly what this looks like on the technical side. And so there's just a lot of potential pieces there that could add up to something. I'm not sure how to get it from point A to point B. So I don't know if this wants to be, or if you would want to make this sort of a focus of the group, if you're really concerned about where data is going to come from. But I think that's an idea with a lot of potential, and I just don't know how to get it there.
Patrick, I know at one point you were thinking of buying new counters this past year. Are you still working on that, or did that not happen?
That's kind of fallen to the back burner right now. I think we still want to do that. I think we at least want to buy up to something resembling the counter fleet that we had, and do what we were doing, which is loan it out to other counters or other local governments. I forgot to mention, I think there's a lot of counter activity going on in other cities as well. I mean, Overland Park has some counters that they've been using sort of on a they like deploy them for like 2 weeks somewhere and then remove them to deploy them somewhere else. I'm not sure how much they're still doing that, but I think they still are. And then I think other cities might have some of that too. I encountered a permanent counter on a trail one time, and I was like, oh, I know what that is. But yeah, so we haven't I haven't been able to put that as a priority yet, but I think we'll want to do some kind of procurement to, you know, I'm not sure we want to automatically go with the eco counter again. But doing some kind of procurement process to do something like we were doing before. But this is such an expansive thing now, which like with the potential role that bigger data could play, that yeah, I just haven't really known where to go.
Yeah, thanks for sharing. Robin, you have your hand up.
Yeah, that was super helpful, Patrick. And there's I thought maybe what I could share is it was shown earlier, our report card data and the grade, an F grade. Maybe I can show just real quickly what the criteria were for that, and that might be helpful. So there's because there's a couple things. So like Patrick, you're talking about, you know, like prevalence data around walking or biking. And that's super interesting. And we definitely are interested in that as a physical activity plan as a whole. So I'd love to talk more about that. Within just the community and built environment, here are, can you guys see my screen? Okay. Here are the criteria that we used for the report. And this is around community and built environment. So this is specific to the environment. And these criteria, there were 4 that we took directly from the National Physical Activity Plan, their national report. So this is again, they're specific to the environment. Communities with sidewalks, trails, bike lanes. The secondary criteria, we were kind of interested in kids. So percentage of children and parents who report having facilities such as programs, parks, and playgrounds in their community, whether those environments are safe, those neighborhoods are safe, self-reported safety, and whether those facilities are well maintained. So those are the ones specific around the built environment. There's also the specific criteria around like active transportation. So those might be a way too of like trying to identify, of all the data that's out there, which ones should we be prioritizing. So.
Robin, do you have a page like that for infrastructure? Like what went into the score?
Yeah, that is it. I believe that's our.
Why is that different than the scorecard that showed it as an F? Like it had different grades.
Yeah, so I think that was active transportation. So let me pull up that. Let me pull up that. So here is the criteria for active transportation. Okay, so that was an F. So that was percent of children and youth who use active transportation to get to and from places, school, park, mall, friend's house. Again, I'll just say it again. Our report was focusing on youth physical activity, which is why you see the focus of this criteria on children and youth. But it could be extended to adults or other more specific populations. And as you can see, only 5.7% of children and youth reported walking to school. So it's slightly different question than, it doesn't get at biking, but does get at walking. So that's why it got an F. I will also note that for the the community environment question, it got a C-. But if you read through that section, the group that helped interpret that result, they made it very clear that even though most people, 70-some%, had sidewalks in their neighborhood, we knew that there were huge disparities in places with sidewalks and the quality. And so we shouted out very clearly that is maybe only some of the data that you really need to answer that question. Does that clarify things a little bit?
Yeah, thank you, Robin.
Yeah.
Matt, go ahead.
Yeah, thank you. Well, looking at that discussion page and also the scorecard and the other things we've been talking about, the first thing that stands out to me, and especially Robin had mentioned that there is a national physical activity plan that this is based on. We know a lot of this data has been recorded and measured elsewhere, especially as it relates to trails or, bicycle infrastructure in particular. And if you've ever done these projects, you know that we utilize that data in public meetings to talk about the why of the project, like why it's important. And, a lot of these sometimes, like in my experience, people are skeptical of this information, but then when the infrastructure is built, they really turn out to enjoy it and use it a lot. And so my point in mentioning all that is that, presumably we aren't the first region that have done a project like this. And so I'm glad that we're having this discussion, but my first suggestion would be look at other regions that have done similar studies, look at what data they're collecting, look at how they're analyzing the data, look at their methodologies, like the whole thing. Because, it's been done before somewhere. I can guarantee you that. And so I mean, that would be, even if we just had a couple to just look at as an example, I think that would be a really worthwhile use of our time. So that's just food for thought there. And then just to sort of comment on something else that Robin said too, looking at the quality of the infrastructure as well as whether or not the infrastructure exists is just as important. And so, for example, if we're looking at bike facilities, it's hard for me to believe that a Shero is going to get the same type of ridership that a cycle track is going to get, for example. So, and again, to comment about the quality of the sidewalks. I mean, obviously we have a lot of neighborhoods where sidewalks don't exist, and we have ones that they exist, but they haven't been repaired for 50 years. So I think there's a lot of things to look at here. But yeah, just those are my comments, I think, off the top of my head.
Yeah. Thanks, Matt. On the point of like looking up studies that have already been done elsewhere, I would love if anyone on the call, like if you have studies that you frequently cite or places you go to kind of prove these data points, if you could share those in the chat or come off mute, it would be helpful, I think, for Teresa and I in gathering some of that, if you all already have some that you look to. And one of the questions I have on this like discussion page is like, yeah, there are a lot of studies that are already done. Do we think there's a need to like replicate a study here in Kansas City? Or is there a need to try to collect a different type of data or study? Or maybe it's just resource gathering from other places and putting that into one place for Kansas City's use. It could be a lot of different things. Yeah.
This is Nicole. I'm just having a little trouble because I feel like just saying data is kind of big. Like maybe if we had, I mean, I know we've got our objectives and stuff, right? But maybe if we honed in to like a subset kind of, it would, I think, and I don't know what that could be. Maybe that's some kind of prioritization process or something. I don't know. I feel like it would be easier for me to get my mind around this if I thought we were looking at neighborhoods that say have a school and I'm just totally making something up, like picking out a certain kind of neighborhood, where you theoretically could walk to the store, you could walk to a job, and you could walk to school or something, or just narrowing down a little bit might be helpful. Like if we had data pointing towards something we were trying to improve or accomplish, maybe. Just a thought, which really isn't directing the conversation specifically.
Mm-hmm. Thanks, Nicole. Yeah, that's a great point. Thinking big data or data in general can be very broad. Some of the thoughts to maybe narrow things down could be like, I don't know, do we do something where we compare two neighborhoods in the Kansas City region, one which maybe would be considered walkable and another one that would maybe be considered not walkable, and we try to compare those two with each other based on percentage of people walking to school or something to establish a comparison there. I don't know if that helps to like maybe make it more specific, but Garrett, I see you raised your hand, so maybe you have a thought.
Yeah, I had a thought regarding that actually, talking about utilizing maybe some of the safe routes to school programs that are in place and maybe gathering some data that way and maybe utilizing like Garmin or some data collection companies like that. Strava got mentioned earlier by Patrick. Maybe utilizing that kind of stuff. I'm not sure if that could be used at the same time and measuring health outcomes that way is just something to think about. Maybe utilizing that Safe Routes to School program that are already in place.
Yeah. Yeah, Katie?
So as I'm kind of listening to everything that everyone's talking about, one of the ideas that kind of came to my mind is that Kansas City is really behind other regions when it comes to how we integrate and require our developers to integrate green space and alternative transportation into residential developments. I have some notes I'm reading off of but essentially, like, all the different cities are competing against each other to get developments in place. And because of that, we are driving down our level of requirements because our elected officials or leadership individuals want to get these development in, but then the developers come in and they pit the cities against each other and say, oh, we can't, oh, we're not going to build a trail through this because, you know, it drives up our costs. We're going to go do it over here instead. So really, it's my opinion, and this is like a big topic across a lot of things, right? But we have to in order for us to make progress, we have to find a way to bring our public agencies together in a united front on how we want to support alternative transportation. And another one of my opinions is if we are able to integrate alternative transportation options where people are actually living, then we will be able to they will be more open to expanding that alternative transportation to where they're going on a wider scale. But if they, you know, we talk about in transit how that last mile is the reason that people are being held back. And this is, in my opinion, where that last mile piece comes into play, is we have to get those requirements in concert with what our overall goals are.
How cool would it be if, you know, using the example of developers going to a city and they're like, yeah, we don't really want to do that. It's kind of expensive. And, you know, we can do it over in this other county for a lot cheaper. And the other county's like, oh, well, we have the same requirements. And the other county's like, we also have that same requirement. It starts to sort of create this regional approach, which is what we really need with our active transportation anyway, to make it a useful, sustainable form of transportation for people.
Exactly.
Yeah.
And I think it's not a utopian idea either, because if you look around the nation, there are several regions who do that. You'll have your pocket agency that will, you know, dig in its heels, whatever. But, you know, once people start realizing this is what our communities want, then they start holding on to it and implementing it a little bit more willingly. So it's not utopian. It just kind of is for us because it's further away from what the Kansas City region has ever like thought they could do, which is crazy because I mean we have no geographical barriers. So it's like, oh, we can just keep going, guys. It's not that expensive to develop here as it is other places, yet they seem to be able to get it done.
Yeah, thank you, Katie. On your thought, or the thing that caught my mind that you said is building active infrastructure, like where people live, will help them to better be willing to take it to where they're going, like the last mile. And I'm wondering, do you know of like any studies or things that have proven this? I feel it in my mind to be very true, and I love that saying, but just curious.
I do not have that off the top of my head. No.
Okay, no worries. But thanks for saying that. I've never heard it in that way, so I like it.
I wanted to share too, we've gotten some stuff in the chat. about Josh shared about maybe looking at transit ridership data, and thinking about how transit access is influencing the way people are moving around, because buses are already counting onboarding and offboarding, and that's also happening regionally. And there is a lot of, cross-pollinating, buses are traveling across state and city lines all day long. Noelle also shared that in Platte County, there's a requirement under the Northland Trails Vision Plan that connects trail implementation with new development. She's not sure how well developers have been held to meeting this requirement, but there might be some examples we can look to from a long-term implementation perspective, making sure that gets connected to new development. There might be some good language in that Northland Trails Vision Plan. Patrick, go ahead.
Yeah, sort of following up on Katie's comment, and for the sake of sort of putting boundaries on our scope, making sure I'm not like going way off track or just establishing that this would be going way off track. I'm wondering if there's work or research to be done around zoning and land use requirements, like how compact developments are, how, mixed, horizontal mixed use instead of necessarily vertical mixed use developments are. What I keep observing, in my work, on the regional trails and bikeways map and on a different tool, the complete streets network assessment, was that a lot of new developments actually have really good trails that are newly being built, but they're also really far away from everything. And I think that's a significant part of the problem. But since we're sort of siloed in these transportation and land use don't really, interact with each other a whole lot. I'm wondering how much land use and zoning regulations would help, but like that might be way outside the scope of this plan in this project. So I just wanted to establish that.
Yeah, well, and sort of to Nicole's point too, we completely understand that this feels very large right now.
Mhm.
And one of the very important things Bailey and I will do after this meeting and before our next one is like think about what might make the most sense. So we're probably going to look and see like where do we already have some data, like where are there data gaps that are reasonable for us to probably be able to get, like what would a project around this look like, and how could we make sure that it's going to have implementation value. So we're going to take all of the expertise and ideas that this group is sharing. And I think probably at our next meeting, we'll be able to present some different options to you guys of like how we've summarized some of the things everybody's brought to us and how we might be able to use that to create something that is, a much more narrow focus, because like I said earlier, there's infinite number of things we could do with data and active transportation and health. And we want to have a focused project. So yeah, no bad ideas today. Maybe in the future, but not today. Okay, Robin shared some information on public transit and walking. Thank you, Robin. We've got about 9 minutes. We're watching the clock. I don't think we have, I think this is our last slide too. We just wanted to keep chatting with you guys. So is there anything else that is coming to mind that you want to share or make sure we're thinking about, or resources? Yeah, go ahead, Robin.
I was just going to say the hardest part, or one of the challenges that we've encountered with the Kansas City Physical Activity Plan, the other sectors that are going on, is exactly what this conversation has kind of, where this conversation has gone today. There are endless opportunities, endless needs. There's no shortage of great ideas. And so the challenge is often, how do we prioritize things? to be most efficient with our limited time and limited resources. So this, we've heard this a lot. So this is a good sign that this group is having those same conversations. One thing that me and my team will continue to try to do is try to continue to kind of bring people back to the plan, the Kansas City Physical Activity Plan, and even the national plan, because those are they're just potential roadmaps for where to go. So, for example, if you dig into the specific tactics for this strategy at the national level, they talk very specifically about using things like focusing on school trips or work trips, or really zeroing in on what walking and biking metrics you might want to use. So there are some things that can help kind of narrow this wide landscape down to a more manageable level that might be helpful as the group makes decisions about where to go. So that's one thing that me and my team can continue to help to do this group.
Thanks, Robin. I kind of wanted to expand a little bit on Josh's transit thought too. Maybe some of you are on the call are aware, I know Robin's aware, there's currently a study going on in Kansas City on the health impacts of fare-free transit. And so that's already ongoing with the team, and maybe at some point, if there's like a good point for them to share some updates, we could provide that to the group too. But that is already happening in Kansas City, which is awesome.
Yeah, just a couple items to expand. My brain's going about 10 different directions, so I'll try to be concise. But there is a lot of data out there, but it's never presented in a helpful format for me. The biggest pushback I get when I ask for new infrastructure is, well, we haven't ever had a problem there before. Nobody actually crosses there, or nobody uses that space. I'm like, I see it every week. Why is it not documented somewhere? That I mean, we can go look at the footprints in the mud path that needs a sidewalk there. But I don't know how to quantify it. So that's a really important part of this group. So I'm glad you're thinking about counters or quantifying it, whether that be bikes, transit, surveys at schools, surveys at parks, or even, the crash data. I put the KDOT map in there of the pedestrian crashes, and I know that Mark has a 2050 Connect to KC plan, and that has a pedestrian involved crashes data in there as well. So thinking about the crashes, and then the walk score stuff, that the walk score question we didn't quite get to, but that does start to help with quantifying some of these intangible things that can't be quantified as much. So I appreciate the work of this group. Thank you.
Can I just add a comment to that? Like what you said is right on. And sometimes what I've observed is that even in the presence of great empirical data, numbers, GIS maps, whatever, oftentimes the qualitative data, the narratives, the personal story of someone trying to cross the road with a grandmother in a wheelchair or a kid trying to get to school, those can have as big an impact as some of the empirical data as well. So that might be something that this group wants to just keep in mind is, having that strong, numerical data, but supplementing it with some qualitative data. And, Bike Walk, I know, has some really great, anecdotal data and qualitative data like that. So maybe just keep that in mind too, you know, because like you said, I may not have a data, but I can see the footprints of someone walking there. That's not in a dashboard or something, but people say they might want it. So.
Mm-hmm. Yeah, I think trying to close out at least my thoughts on how Teresa and I can move forward with all this information. I think like the region as a whole, you know, we have quite a bit of data available already through Mark's connected 2050 layers on their GIS to, you know, walk score to the things the Kansas City Physical Activity Plan already gathered, like number of kids walking to school in an area. And maybe there's ways we can use existing data, like to Josh's point, and just frame it in a different way. Like, can we overlap two data sources to write that story in a way that maybe hasn't been written yet, but that the data kind of already exists? And then how to tie it into like health impacts, to Christina's point in the chat of like, oh, there's studies that it's a health impact of $355 per person per year if you don't live within a quarter mile of a trail or sidewalk. So maybe we can look at how to tie some of this together.
Okay. Thank you so much, everyone. We really appreciate your time. We don't take it lightly having so many professionals gathered in one room for a whole hour together. We know how hard it is to make the time and to share your expertise out of the goodness of your heart. So thank you so much. Bailey and I are going to sift through all of this and start to try to make sense of sort of the active transportation soup we've created here today. And then we will send out meeting notes. And with those meeting notes, we'll include a doodle poll or some other meeting link so that you all can let us know when would be a good time for us to visit next. If we're going to do our quarterly visits, we're probably looking at, you know, sometime early summer, May or so. So you can be on the lookout for those things. That will come from Natalie. And in the meantime, if we have things that we feel are important to share with you all before we meet next, maybe some things we'd like to just have you mull over before we meet, we'll make sure to send that to you with enough time to review it. And if you have any other thoughts that pop into your head, or you come across a data source or like a case study example of something that you think could be really valuable, please send it to us. We'd love to take a look. So thank you so much. I hope you all enjoy the rest of your day. It's supposed to be sunny and 57. So I hope you can get some fresh air, stretch your legs a little bit today. And we will see you at the next one.